grounded in best practice from the Department of Justice, and it will allow us to do it with fidelity, which is a really important part of how we get to the numbers that I've indicated. Next slide, please. The funds will be used, as I mentioned, for social service agency contracts. GBI requires a full-time project manager to be done and implemented with fidelity. That position is really designed to manage all three of those working groups and make sure that people are staying at the table. Outreach workers are also, as I mentioned, a very important part of GBI. The outreach team allows us to be really grounded in communities and for that ongoing case management to be happening with the young people who enroll in the program to make sure that their transition into a non-violent lifestyle is seamless. We want to make sure that unlike many other programs that young people enroll in, where they're told, oh, go over here, try this program, do this, that they really get an opportunity to plug into programs with a great sense of ease because they're being walked through it with a case manager and outreach workers. And then community education is also a really important part of the funding opportunity. We want to make sure that community residents throughout the city understand the GBI model, that they see the benefits, and that they understand it's a partnership between community, social services, and law enforcement. And that concludes my presentation on GBI. I would be happy to take any questions.
So I have a few questions. You talked about the data that was used early on, I think, to identify these individuals, and I'm wondering if you could be a little bit more specific about how they might get identified to be part of the program.
Sure, thank you, Sir Chair. And basically, the police department do a 2-day analysis with David Kennedy and his team, who are the technical assistance providers.
And David Kennedy is from
David Kennedy is the founder of GBI, and he's from John Jay College and the National Network on Community Safety, which provide technical assistance and training on the implementation of GBI.
And is that part of the grant money goes to pay for David's time?
So David's time is actually paid for through the national initiative.
Okay.
So we're very fortunate that this becomes a collaboration that's already been grounded in the police department's work, that our partnership allows us to bring in that community moral voice and the social service aspect of it so that the program can be done with fidelity and in a total way versus just one leg of it, which we know is an ineffective way to do it. So the data piece, as you asked, comes in with them doing a 2-day overview of the shootings and homicides in the city and who the perpetrators are. It's a police kind of closed door practice. So I can't say that I understand all of the details, but it is a tried and true method that's been used in a variety of cities across the country to identify which groups are at greatest risk for being the most violent and who those members are that should be targeted for an intervention.
So I just bring that up because there's kind of a hypersensitivity that I have to making sure that there's fair process going on and that people aren't somehow profiled as being more dangerous because of associations, because of demographics, because of geography. So I just think that as we move forward, and maybe it would be worthwhile bringing in the Office of Equity and Inclusion to help review some of these things, because that it would be that's a risk involved, and it's better if it's like tied to I think hard, clear data.
Sure. So, Chair, I'd be happy to provide additional information about the way that process happens. I apologize that I don't know all the ins and outs, but I know that we do need to be sensitive to the needs of the community and making sure that it is a transparent process as best we can. I know that largely it is looking at police contact and then also risk and protective factors based on community contact. So those are the two primary elements, but we can certainly get additional information.
And maybe we can lift up some of that. What are the data? So how do we know? You also mentioned 30 individuals, but is that the number that we're expecting to be involved in the intervention program, or is it a higher number than that?
So at each quarterly call-in, 30 people are invited. So you're roughly estimating 180 people a year that you'd be inviting into, or 120, excuse my math, that you'd be inviting in to come in for a call-in. There's also the custom notifications that allow you to make a more on-the-spot invitation to participating in GBI. It's difficult to say in the first year how many people you'll actually retain, but the ongoing success has shown to be very effective.
And I have a couple more questions, but I know that other council members do as well. But I'll just ask one for now. Besides the call-in, you had a slide that talks a little bit about more of a quick response as needed. I forget what that was actually called, but if you could go back a few slides, it's the one where the call-in got mentioned. This one, custom notification. So is custom notification, is that more of the ceasefire response that could, when a critical incident happens, that then there's more of a, we don't have to wait for the next quarterly meeting. We can get outreach workers focusing in on an incident and actually try to prevent that retaliation or those other things that sometimes happen.
Yes, the custom notification can be used as a critical incident method. So it allows us to identify a young person, as I mentioned, who might have been involved in a recent shooting or somehow has been elevated as being at risk for being involved in a soon coming incident. And it allows us to get outreach workers as well as those social service agencies to wrap around that young person and really offer them whatever services we can make available to avoid that, both that retaliation, but also the long-term involvement in that group.
Thank you. I'll have a couple more questions, but I'll give Councilmember Glidden a turn.
Thanks, Mr. Chair. And like others, I'm just kind of wrapping my head around this. Just one just kind of basic question I have, looking at the fact that the grant is for $325,000 to be spread over 2 years. That actually, it makes me kind of wonder, how are you going to be able to do this program, which seems like it needs at the least, I thought you had identified, and we don't have a copy of your slides, by the way, so I'm just trying to remember too what's going on there. But that you have a manager, someone to manage the whole program, and then contracts with social service agencies, and then contracts with outreach workers, either, I guess, individually or through a nonprofit organization. And so that just seems like a lot to be able to accommodate in, again, when you divide that up over 2 years, that's really only, what, $160,000 per year to be able to do that. And so just kind of curious about the ability to do this in a way that will achieve the results that you're hoping for.
Thank you, Chair Gordon. Thank you, Councilmember Glidden, or Council Vice President Glidden. I apologize for the
doesn't really matter.
Error. To your point, yes, it is. Does seem like a stretch in some ways, but what we've learned from working with our TA providers is that it really is about trying to think about a reallocation of resources. And so the core funding does go to supporting both the position and the contract for the outreach workers. Once we get the relationships developed with social service agencies, we hope that we can navigate that at low cost, because many of them are already providing many of those services, and just being able to lay out a platform that will allow them to plug into a system really requires.
So how much do you think will go to the manager position, and then how much will be left for working with the kind of outreach contractor?
So fortunately, 30% of my time is already being carved out, so that comes at no cost to us at the city level. And then it leaves about 70% of the budget to go towards outreach workers and contracts.
So you will be reassigned, or part of your time will be reassigned, and you think that you can oversee this entire program with 30% of your time?
Well, the project management position will.
And that's not I just want to say that's not anything about your great skill. I'm just saying that you're already doing a lot, and this seems like a big new program. That's all I'm saying.
It is. And so we will be looking at coordinated staff efforts and realignment. But we are also, the mayor has also included funds for GVI in her budget to City Council. And so there's also a request being put forward to the city.
So what's that amount for?
There's a ask.
Looks like your director might want to pop in here.
Gretchen, I do. Can you tell?
Yes.
Thank you, Gretchen Musikamp, Commissioner of Health. The mayor is recommending, and this was prior to us learning about receiving the grant, but we think the grant can be woven in and really help us get a good start. The mayor is recommending $140,000 of ongoing, which would help support the city's role in being the manager and keeping the wheels spinning on all the different parts. And then one-time funding of $150,000 to jumpstart the beginning of this program. Since the police are all trained and ready, we need to really get the other two legs of the stool going quickly. So that's in the mayor's budget. Especially important, I think, is that ongoing support so that we can see that this will keep going into the future, even as we get things started with the social
Was
service.
the mayor's funding intended for contracted outreach positions? Is that? And I apologize, I wasn't at the budget subcommittee meeting on the day you did your presentation, so I apologize that you're probably saying things everybody else here knows.
Mr. Chair, Councilmember Glidden, I don't know if I was as specific as your question during the presentation. The mayor's one-time funding, I think, is to be spent for outreach or gathering the community to begin to articulate that community voice to get things started as Sasha has described.
And okay, so then I guess my outstanding question, which is more for I think offline discussion, is really how much are we going to be able to dedicate through internal staff to manage the program? And, you know, is there, anyway.
Yeah, Mr. Chair, Councilmember Glidden, I think looking at that ongoing funding is the place to get the answer to the
So then
staff.
you would, okay.
And this is a program that we hope to implement in both North and South Minneapolis as well.
Just to tail in on that piece, it is the data-driven piece of it really indicates where the implementation will happen. So it allows us to do a citywide implementation based on where we identify the greatest need.
Councilmember Bender.
Thank you, Mr. Chair. I have a number of questions. So first I wanted to understand, you mentioned briefly the national initiative for restoring, how does it go?
There's
for
so many
building
initiatives.
community trust and justice. But my broader question is how this program ties into that bigger work, as well as where did the idea come from for this program? Has it come out of those conversations? I had the chance to ask the police chief about this during her budget presentation, but I wanted to give you the chance to talk more broadly about how this fits into the bigger picture.
Thank you, Chair Gordon. Thank you, Councilmember Bender. The national initiative on, I want to get it right, on community trust and justice, as many of you know, is something that the police department has been participating in for a few years. GVI is a core function of that project. So in the city's guidebook about their implementation with the national initiative, GVI is mentioned as one of the strategies that they are to use. And that is also being provided TA by David Kennedy and the National Network for Safe Communities. Lots of national work happening here. So it is very exciting to be included. There's lots of support for it happening across the country. Similarly sized cities to us that are using it are Indianapolis, Indiana, as well as Gary, Indiana are using it, and Scranton, New Jersey, as well as Detroit, Michigan. So there are some cities that are similarly sized to us, as well as some much larger cities like Chicago and, there's another one that I'm not thinking of, Baltimore, that are using this initiative and seeing great success in the particular communities that they're using it in. And so nationally, we've seen great success with the model, and locally, we hope to be able to implement it to scale as similar to the size cities that I've mentioned. I hope that answered part of your question.
That's very helpful. I also wondered going forward, you mentioned some of the very specific ways that community members might be involved in the call-ins, but how would the community, it seems like something that's a really important partnership between the city health department, the police department, and the broader community. And so can you talk about how the community might be involved in shaping, identifying the folks who might be called in, or in any other way, the kind of broader community conversation that would happen around this?
Yes, thank you, Council Chair Gordon and Councilmember Bender. The community and social service agencies and law enforcement all have work groups attached to the GBI model. So there are work groups that meet on an ongoing basis, one of them being community members that are self-selected. So it's not something that the city will arbitrarily pick people for, but really will be based on people's personal commitment to wanting to be a part of the development of GBI. They will really provide that community input on what they want to be seeing on the ground. We are very much in the infancy stages as we've just received the funding and developing the community moral voice work group as well as a social service component. We know that law enforcement has been in training and developing their work group for some time, so we're playing a bit of catch up. We're really excited to get in the community and begin to get feedback from folks on the design, which we think will be really important to its success.
That's great. And then actually, could you go back? I just have two more questions. Could you go back to the slide that talked about the outcomes that have been seen in other communities that are using this approach? There it was. I think 35 to 60%. It strikes me that this approach assumes that people who are committing violent crime wouldn't do so if they had other options, like all of the support systems that you mentioned that come at the end of the meeting. But I wonder if you could talk about what you've heard from from folks who've been involved in this work in other communities. Why is this showing these rates of success? Whereas, yeah, that's a good enough question.
Thank you, Chair Gordon. Thank you, Councilmember Bender, for that question. What we know about the problem is that it's a both and, that we do need a strong law enforcement presence and that sometimes arrests need to be made and prosecution has to happen in order for us to get a stop to the violence that we've been seeing. But we also feel like there are people, particularly young people, who, given alternative options, can make a real change and can be a constructive part of our society. And so this is not to say that we don't want to hold people who perpetrate crime accountable. That's not the design of GBI. It actually has a very strong law enforcement piece. Part of the call-in is really a strong message from law enforcement saying, you've got a bullseye on your forehead. You know, we know what you're up to. We're just putting the pieces together to be able to charge you with something, or, you know, the writing is on the wall that either incarceration or death are in your near future if something doesn't change. And so we want to give you the option to make that change. That's really what the model of GBI is. And so one of two things generally happens, and I think that's the reason why we see such success, is that people either take the sincere offer of help and begin to make changes in their lives, or arrests are made. And either way, we see a stop in the violence.
Thank you. And then my last question is actually back to the budget. I just wanted to just really understand, because I did remember the budget proposal, the $150,000 in the budget. I think you may have said this, but I just really want to understand what the need for the city funds is versus the grant funding coming in. And so can we do it without the city funding? Can we just use the grant funding? Or why is this $150,000 in the budget? Which, by the way, I would consider a very small amount of money to be investing in this kind of work, but I just really want to understand it.
Mr. Chair, Councilmember Bender, I don't know that we've had time to analyze those two funding sources that are short term. One being the $150,000 and the other being the grant funding. I do know that the long-term funding we definitely know we need from the city in order to get this thing operating into the future and see its full effect. I believe I'm going to have to promise you that we will do a crosswalk between the grant and the one-time funding and get that information to you about its difference or similarity in use so that we can think about if it adds and complements or if it's redundant, which is what I'm hearing in your question. I also wanted just to volunteer as long as I'm up here. In our work in youth violence, we've certainly seen from the young people that we've worked with in a number of ways that these are the kinds of elements that Sasha has described for you as key to the GBI approach are responsive to needs we've heard from young people. We did an initial attempt at what is now our more robust program in the HCMC, but where social workers met with the young people who'd been injured in the hospital and asked them what are their risk factors, what are their needs. And I was expecting something kind of new and exotic, but what I heard from them is they need housing, they need jobs, they need education. And so we really do need to help them get those things in order to turn their lives around. We also know that from an effort that we called North 4 that is still operating with Emerge, that intensive case management of gang-affiliated youth does help those young people move towards employment and get employment. It also keeps them from being injured violently and cuts down on the amount of further crime that they're involved in. So that we know, and that's not paired with the police interaction, but these efforts are similar to homegrown efforts and yet are more robustly done. And so we're excited about this opportunity to tie it all together.
Thank you. If I might just make a brief comment, Mr.
Of course.
Chair. You know, I wanted to say that I think that, again, this is a very small amount of funding in the scope of our budget. And I had the chance to ask the chief what she thought of it. Of course, she's been very engaged, as you know, but she was able to share that with us, and she was very supportive of this approach. We have what I would consider a very significant proposed increase in our law enforcement budget. And I cannot imagine us as a council making that investment without also investing in this approach to give youth in our city a chance to have another pathway forward. So I want to thank you for your work on this. And I just can't emphasize how, what kind of signal that would send to our community if we said that we think the only answer is more police and not investing in our communities in the way that we know works. I've said this before, but our health department uses methodologies and evidence-based strategies, and I think, as I'm hearing here, that will apply to this program as well. So I'm very happy that you're bringing this forward, very thankful for the work. It sounds very intense and difficult, and I really thank you.
Thank you, Chair Gore. Thank you, Councilmember Bender.
Thank you. And I just have a couple questions. Maybe we don't know the answers of these yet, but I was curious about how many outreach workers we thought we were going to be able to have based on this funding, just out of the grant funding alone.
Sure. Thank you, Council Chair Gordon, Committee Chair Gordon. We are hoping to have 1 to 2 part-time outreach workers with this allocation of resources to start the grant out with. If city allocations are made, there will clearly be an opportunity for increase, and we may, look at increasing that and drawing back social services depending on the number of people enrolled and based on the needs for services. So it's very much in its infancy stages, and I think there's a lot of room to negotiate what the heavy burden is on the financial aspect as we get into actually providing the services to the young people.
Okay, that's not very many outreach workers. And for some reason, I'm seeing the outreach worker playing 2 roles that we've talked about a lot in the past. Even before you got here, we used to talk about outreach workers who could actually go do home visits with people we thought were particularly at risk and do kind of check-in and support if they had time. But we also talked a lot about, and the Project Ceasefire used to have this term, violence interrupters. Somebody, when they think something's about to happen, could go into the community and help mitigate that and prevent it and be a peacemaker. Will these outreach workers function in that way at all?
Thank you, Council Chair Gordon. They will have some remote capacity in that way. The design is particular to a caseload, so it is really designed to meet the needs of those young people who have been identified and who need those intensive services to provide them with 24-hour care. But there is some room for them to do some on-the-ground work, along with a different grant that we got with the Youth Coordinating Board. We'll be doing some outreach work on the north side as well.
Okay, so it sounds like the outreach workers may have a list of 15 or 20 individuals that they're trying to actually do outreach to.
Thank you, Council Chair Gordon. So there's 2 separate grants that we're talking about, but outreach will be increased on the north side through one of them for certain. So with our CDC grant that we just received, there will be outreach workers that are focused more on a high school age range of youth.
And I don't want to get the committee too distracted on that one, so I'm aware of that happening there. But
we don't want to confuse you.
But these outreach workers will be focused on
a case management strategy.
And they may have
10
or 15 clients?
At a time, yes.
At a time, okay. I'd also be interested to hear what other cities that have done this program, what their budget was, how many clients or individuals they were serving. Just doing a little of the research that I've seen, it sounds like Boston was kind of a pioneer in this. Salinas, California, Newark, New Jersey, Cincinnati, Ohio. And when I also was looking at one of the things, it looked like Cincinnati was able to go through their vetting process and looking at their data, and they identified 1,500 individuals that they thought fit. Newark identified 1,470 individuals that they thought fit and were likely responsible for a lot of the being victims and victimizing others. And so it just occurs to me that if we did ours, we might even have fewer people that we could identify, and what a great impact we could actually have if we could just invest the resources to get them the right case management, outreach workers, mentors, leaders, whatever, this community group that could go around them to save or help or bring them back. So, but it's hard to know how much it costs and the cost and benefits. So it will be exciting to see this program unfold and for us to kind of test the waters in this. And I hope we can bring it up to a big enough scale to actually get us the results that we want.
Thank you, Chair Gordon. That is actually spot on with what we're hearing from our federal partners, that Minneapolis is uniquely positioned to be able to execute a program like GBI, if done with fidelity and the right resources, to really get out in front of the problems that we have, because our community is slightly smaller than some of the other places that you talked about, at least in the sense of the level of violence that they're experiencing. And so we're very fortunate that we can begin to take some steps in the right direction and hopefully implement with fidelity and with the right amount of budgeting to be able to ensure that we can address the need.
Thank you very much. Councilmember Fry has a question or comment.
Combination. Thank you, Mr. Chair. Thank you, Ms. Cotton. Really appreciate your work. There was a figure, I think several slides ago, that noted a 35 to 60% reduction. Are you able to track the reduction resulting from arrests versus the reduction based on finding jobs, improvement in society, et cetera?
Thank you, Council Chair Gordon, and thank you, Councilmember Fry. With this project, intense research is a part of the process, so we will be monitoring very closely the number of young people who are enrolled in any set of services and what the outcomes are, both at the city level and through those social service agencies. So actually in year 2 of this funding allocation, we have money carved out to partner with a research agency outside of the city in order to be able to do a small project that will really analyze that data from a neutral place.
That's great. So the 35 to 60%, that's other cities, obviously, since we haven't implemented it yet. Do we know from those other cities what the results are, arrests versus out of prison improvement?
Thank you for that question, Council Chair Gordon and Councilmember Fry. I don't have the specific breakdown in front of me, but I'd be happy to provide it at a later time.
That'd be really interesting. Thank you for.
Again, I'm going to jump right in.
Yeah.
A thought occurs to me that this, Councilmember Gordon, right, that really this is an add-on to our existing police activity.
Okay.
And so one can assume that the arrests are there
Regardless. Okay.
And so this is extra on top of that.
Understood. That's helpful. Thank you.
Thank you.
I don't see any other questions. Oh, yeah. Oh, President Johnson, sorry about that.
Thank you, Mr. Chair, and I appreciate being able to sit in. And I want everybody to know I had a nice briefing about this program last week, and it seems that it is a positive step in obviously identifying people who are most likely to be either involved or victims of some of the violence that's going on. But I'm just curious, when I look at 35 to 60% reduction in homicides, I mean, are those numbers before homicides started going up when you gave the list of cities? Every one of the cities that that was mentioned has had an uptick in homicides in the last recent past. I mean, we're all reading these stats every week. Is it have people walked away from this program, or is it continuing to be implemented in some of those cities?
Sure. Thank you for the question, Chair Gordon and Council President Johnson. The program has been implemented over the last 15 years in cities across the country. And so the breakouts, the start of it really happened in Boston and has since spread across the country. And so depending on the number of years that it's been involved, the numbers may look a little different. This is an average, but I'd be happy to provide a city-by-city breakdown once I can request it from the network.
And then, Mr. Chair, just we have this grant from Department of Justice, the $250,000 grant, and you're saying it's going to be paired with another grant that came through the Youth Coordinating Board. Did I hear that correctly?
Thank you for the question, Council Chair Gordon and Council President Johnson. Actually, they are two separate grants. They are not paired. They just happen to come through at the same time and will both offer the opportunity to enhance our youth violence prevention efforts.
Gotcha. Okay. But there also is then a budget request. And so, and I apologize, I don't have my computer. So will we see a budget of how this, because we've got a budget request of one-time dollars, I think, for 140 and the other's 190. I can't remember which is which, but will we see how those dollars complement this grant, and so we get a budget of the full program? And the other thing that I think is of interest to me anyway is exactly how does the work break out between the police department and the health department? Just that kind of information I'd be great. And I don't need it today, or an answer today, but that would be helpful to me.
Thank you, Council Chair Gordon and Council President Johnson. We'll be happy to break down how the work looks and to provide a more detailed background at a later time. And remind me of your first question. I apologize. Got lost in the minutia. The budget. So yes, we can certainly analyze what our first budget is in the grant and compare it with what the budget request is to the city, and do some compare and contrasting, which the commissioner has already made an offer to do.
In terms of the second question, maybe you could just briefly tell us if there is some kind of coordinated steering committee or a group that helped apply for the grant. Was the police department at the table with you when they did that, and who from the department would be the lead?
Sure. Thank you, Council Chair Gordon. I thought I heard you moving. Okay. There is an executive committee of youth violence prevention currently, and this work will live as a subcommittee of that group that will have both members who are appointed to that committee at the city level, so city members, community members, clergy, as well as people voluntarily who want to participate in helping to plan that work overall. As I mentioned before, there are 3 subgroups that are called working groups that operate with a focus area. So there'll be a law enforcement work group that is largely made up of MPD, Hennepin County Sheriff's Department, probation, the U.S. Attorney's Office, the City Attorney's Office, so all the fancy law enforcement folks. There'll be a social service network working group, which will be made up of both social service agencies who are providing services, but also those who want to be involved to provide input and knowledge content. And then there'll be a work group made up of the community moral voice, and those are folks from the community who want to be involved in both the planning and implementation of GVI.
Okay. Thank you. I don't see any other comments or questions. Thank you so much for joining us, Council President Johnson.
Thank you for your
very
time.
much for the presentation.
Thank you all very much. Have a wonderful afternoon.
All right, you too. I will then move the motion before you accepting the grant from the Federal Department of Justice under their Safe and Thriving Communities Approaches to Prevent and Heal Violence. Any further discussion on that motion? Seeing none, all those in favor say aye.
Aye.
Any opposed say no. That motion carries. And seeing no further business before us, this meeting is adjourned. Thank you very much.
Thank you.